Good afternoon, folks. Hope you're good. I'm Jack Chew, and this is Will Alty Chew's Health. And we started it last week, and then as of yesterday, I lost my voice. I've got a bit of a cough, got a bit of a cold, and then I literally lost my voice. I couldn't stream yesterday, which is what I do for my interprofessional work. So I do a lot of teaching for physios and other professionals in the pain and injury space. And I mentioned last week, for those that tuned in, that I've started to then stream for my local lay public because it makes no sense that we've been doing lots of education around this stuff for years, but not necessarily then translating it for you, our customers and our community, our colleagues. Sorry, I've been doing work for my colleagues. I've not been doing work for you, the public. So we're doing some translational work as best I can to try and help you understand pain and injury better, and what that means for you and how you can better manage your health, because that's sort of the fundamentals of what we do as a therapy team. I'm based here in Chew's Health, which is at Timpley Sports Club, and so I'm pleased to be with you. I'm a podcaster and streamer that then often educates people on the best practice, evidence-based ways in which you might treat knee pain, back pain, shoulder pain, etc. And so fairly well qualified to then explain how to do that in practice, because I also, then my other part of my work is then doing just that. So talking a good game on the internet and then delivering it in practice in a bespoke facility here in Timperley. And so one of the things I did last week is I talked a bit about New Year, New Me being an issue in some ways. You know, it has good elements, bad elements, and ugly elements, and how you can avoid succumbing to some of the worst characteristics of that. What I intend for this show ongoing, and for different weeks we'll do different things, is I've been talking to my patients or a few people that tuned in about what they feel would be useful things for me to cover in those early sessions as we build up a head of steam and a momentum with this. Which is interesting, because I was worried I wasn't going to be able to stream today. Having lost my voice yesterday, and I literally couldn't go on air for my other show, meant that I then had this thinking that my second live stream on this feed was gonna have to be cancelled because I couldn't talk. So I'm glad to be with you. And you'll notice that there's a bit of mixed branding on that intro sequence. Chewing It Over is one of the shows that we do, but I've not got fancy graphics and stuff for this Will Alty Chew's Health thing that'll be coming in the coming weeks. But I just thought I still need my intro and outro sequence, and so I've been repurposing those. But we'll change the branding up in coming weeks. I just want to give you a bit of a clue. I spoke to a few patients and said, what do you think would be smart? What do you think you've learned most from by working with us and understanding your health better? And they said that one of the things they felt would be smart for me to cover would be how pain and injury treatments work. They found it really interesting to learn more about their bodies and to understand their myths and misconceptions that they once thought about, that they now realize is not the case. And so that's what we're going to cover in today's session is how do pain and injury treatments work, and also then therefore naturally how they don't work. And whilst I'll answer as specifically as I can, there's also, of course, still lots of learning to do and lots of mystery associated to that. But it seems smart for me to cover that, and so I'll get stuck into it. The main reason for doing so is because knowledge is power, and if you can know better, you will do better. It's better to be informed and to not then feel like you've succumbed to a myth or a misconception that could otherwise be better understood. So before I get stuck into the individual sort of pain and injury treatments per se, one of the things that I really wanted to clarify, and what I did with patients when they were saying that was something they felt I should cover, is that the reason that they felt that it'd be smart for me to explain how things work is because they felt like they had been in the past, or they had family members that had misunderstanding of how things work, and therefore that motivated behaviors that then didn't necessarily correlate with great health, and so people had made mistakes going down into types of care and treatment and treatment styles and stuff that hadn't then helped them in the long term, and that they felt that then a better understanding of how things work and how things don't work might well have meant that they could make better healthcare decisions, particularly when it came to pain and injury. So one of the things that I felt like it was a sensible starting off point is that there's a concept called correlation and causation, and I'll try not to get too nerdy about it. But essentially, a correlation is of course where two things can be happening at the same time, and that they might well correlate. So a positive trend in one thing can lead to another, or be correlating with another. Sorry, not lead to, that's misleading actually. But yeah, two things can correlate, two things can happen at the same time, right? And that does not necessarily mean that one caused the other, or one even contributed to the other. It could be completely random and incidental, right? Two things might happen at the same time that are completely separate, or it could well be that correlation, that similarity between two trends might be because they are interrelated. Okay, and so if say in this case, it's a perfect example with, if height and weight might correlate as children grow, that is usually because they are intertwined. Okay, but if you've got two factors that are completely separate and are completely incidental, if a child's weight goes up at the same time as something else completely random at the other side of the world happens, then you know that those things are unlikely to be related. And so you've got this interesting situation where sometimes things can trend together but not necessarily be related to each other. The reason I'm mentioning that is because it can be a real classic mistake in my sector, in the pain and injury sector of healthcare, whereby things that are then trending together and look to be happening at the same time or moving at the same time are seen to be directly linked. And so let me give you a few examples. So when someone is found to have a certain difference in their movement patterns, so they're assessed for a back pain and they are moving a certain way, and that then is considered, they happen to have pain, they happen to move a certain way. Is it that those things are one causing the other? So is the pain causing the movement pattern, or is the movement pattern causing the pain? And there are various different things that suggest that sometimes it's one, sometimes the other, sometimes it's both, sometimes it can be hard to tease out those variables. But what I'm getting at there is that those things might correlate, right? You happen to have had a pain increase and a movement behavior change, and those things necessarily aren't perfectly, you don't know how related they are. It is tempting to make a case for one or the other. And I think that that's where people make the mistake of then thinking that I'm moving badly and therefore that's what's hurting me, or that I'm moving badly purely because it hurts. And it's really tricky for people to ease that up. Now, when you've got an obvious limp, right, you've sprained your ankle and you've got a limp, and someone says, why are you limping? Because my ankle hurts. Then it's something that's more obvious. But when it comes to certain movement patterns or positions or postures, it might not be quite as obvious as that. You don't know for sure that you're moving a certain way because it hurts. It could be something that actually you're moving a certain way, and eventually over time that's contributed to you ending up with some sort of pain or dysfunction or an issue with things. So now I'm talking now. I'm not even got into treatment yet, but just to clarify, when it comes to correlation and causation, we then mean that if then any treatment that you have improves the pain, and then you were to move better because of that, and by better I mean differently, I suppose, in this instance, is that it's reasonable for you to think that then the treatment that you had caused the improvement in your movement pattern or change in your movement pattern. Excuse me, sorry, tickly throat. But actually what I'm getting at is that might well be incidental again, is that you've essentially had some treatment that then has made things more comfortable, and much like taking a painkiller might make you move differently, it wouldn't necessarily mean that the underlying thing that happened in the treatment is the thing that made you move better. It might be that it's more pain-free. And similarly, if you were to correct for other biomechanical features and factors, then it might well be that things hurt less, but it wouldn't necessarily mean that the treatment is exactly the thing that is related to it, especially if it comes at a phase where things are getting better or could be getting better. We see people sometimes come into therapy clinics for a check fairly soon after a sprain or an incident, whereby, of course, the trajectory of that injury may well be positive in the next couple of weeks anyway. So whatever it is we do with them or to them may well be that was an incidental part of a natural recovery. And it's sometimes hard. Can we accelerate that recovery? Yes, sometimes. Can we sometimes negatively interfere with that? Possibly. But it's just meaning that generally you don't want to assume that it's the specifics of a treatment that can then get someone better. And this is one of the things I wanted to make sure I covered before I explained what some patients and others had suggested I should cover today, which is how do treatments work, and that reason I'm going there first is because it's all more vague and broad than you might think. And I think that that's one of the things that is important to think about. So, oops, I've clicked the wrong thing. Clicked the wrong thing there. So, oh no, that's fine. How do pain and injury treatments work? So to get into that, I'm going to go through a few of them and just explaining off the back of what I've just described as to how sometimes that can then lead to compelling but false narratives that can exist. So one of the classic things that people will ask me is, what is it that helps when people were to lay their hands on me? So be that massage, mobilization, manipulation techniques, various things that therapists might do to you to help with your pain and injury. And the understanding how these things work is a really interesting and somewhat contentious thing within our sector. One of the things that has been a long-standing understanding that has then, in recent times, I'd argue recent decades, really, for the last 10, 15 years, we've known better than this. But generally speaking, people feel like sometimes that they get an injury and there is then the tissues have then tightened or stiffened or scarred around that injury, and therefore getting a skilled professional to dig their thumbs into various different elements of scar tissue to break it down or to help flush the tissue, or if it's a joint that needs mobilizing, that these things can get stiff, and therefore it takes someone to then mobilize and manipulate them so that they will move more and move again, and that they are then correcting with their hands these elements of stiffness, tightness, etc. And it's an understandable thing why people feel like that. So the reason I started to talk about correlation and causation is because that's a compelling narrative, right? Is that people then have that sense of tightness, soreness, tenderness. They have treatment that then goes about trying to address that with the perception that that's breaking down scar tissue, it's mobilizing stiffness, and therefore making a joint move more because that tissue is more pliable, and therefore then it might hurt less after that. It's therefore understandable why people think that how that worked is it did what we thought it did, right? It breaks down the tissue, it then opens up those joints and allows things to move better, or flushes toxins and all sorts of other things that people perceive. Now, what we've come to understand is that actually the main thing that the treatment is doing that then provides that effect in some people where it can relieve things, and that's why we do it all the time, is that it's often that is essentially administering a mechanical form of paracetamol. Essentially, you are then offering a pain relieving technique that then, especially applied with appropriate skill, might mean that then that involves massage, manipulation, mobilization techniques to people that then can alleviate symptoms and help them to move more comfortably. But you haven't necessarily, like we used to think, corrected for tissue faults. You've not broken down scarring. You've not necessarily made massive changes to that tissue when you've done those techniques, no matter how aggressively or how specifically you've done them. And that applies especially when we think about spinal mobilization and manipulation. Sometimes it's then people perceive that I'm out of alignment, I then get clicked back into alignment, and that's what. So I was out of alignment, therefore it hurt. I get clicked back into alignment, it therefore hurts less because I'm now moving properly. And then as long as it don't fall back out of place, I'm moving well, and I just need to have that for maintenance. Those things have been tested and studied very carefully, and also we've increasingly realized it makes absolutely no mechanical sense or how to put it. It doesn't make any evolutionary sense that we would be so vulnerable and fragile that we would fall in and out of alignment in such a way and need adjusting manually to get back into place. However, what can happen is if it feels that way, you then get manipulated into position and it feels much more comfortable. Instead of thinking, I've just taken a version of pain relief that therefore makes me more comfortable in order to, and therefore I can move better. you therefore then will attribute the correction of the fault as being the solution, and therefore not necessarily be able to then empower yourself to move on and move differently. And so that's the reason that it's sometimes smart, and some of my patients have asked me to come on air and talk about this, is because they found it really valuable to understand the mechanism underneath those things as to how things work and how things don't work, in order for them to not perceive themselves to be so vulnerable and fragile, or that it's not safe to exercise, or that they might need to be routinely seeing therapists, even though they're doing okay, just as a means of making sure that their tissues are in the right alignment, or excuse me, sorry, that they're in the right alignment, or the right tissue behaviors and things like that. So that's why it's sometimes useful for you to know. And the other thing is that applies to some extent to people that want to imply that you are moving badly. So when runners come into clinic, especially, I do a lot of second opinion work, and they will come in saying, I've been told I run badly, or I've been told I do this, I overpronate this, or I heel strike, or that there's all sorts of different dysfunctions that have been suggested as to why they might have knee pain, ankle pain, Achilles pain, back pain. And so the reason that sometimes then changing someone's running pattern, their shoes, doing some treatment, might be some of the treatments I've just mentioned, or giving them sort of strengthening exercises or core stability, whatever, anything that you might do to try and change that situation. If that then means that it hurts less when they run, then you might think, well, it doesn't matter how it works, it just worked, and that's great. But the reason really as best we understand it is that people's running patterns and form, that sometimes really matters, but it's not necessarily about how they move relative to a textbook normal. They might well be well adapted to running and moving like that. Some of the best runners we've ever had, and certainly most of the runners that I ever meet, have got their own little quirks, but they might be based on just their nature, and it doesn't necessarily matter. And some of the things that have been found, say that in a shoe shop, or someone that's scrutinizing their biomechanics and movement patterns really closely, they might find that these things are there, and they have made a correlation to their pain. They've assumed that that's what's causing it. So you happen to move that way, that's your running form, you happen to have pain, they've then lumped those things together, implying that one's causing the other. Right? Usually that your movement patterns are causing your pain. Sometimes they're accepting that sometimes it might be that because it hurts a bit, you might be moving like that. Usually it's the other way around. You're moving badly, it therefore hurts, that's causing it to hurt, and therefore it needs to be changed. This is what gets tricky, is that if someone was to then put some insoles in your shoes, change your footwear, give you some strengthening exercises, and get you to move differently, any one of those treatments, what you've essentially done is you've changed things. And let's just say that they also change their running behavior. So they might adjust when they're running, how much they're running, how fast they're running, that sort of stuff. Enough has changed. If enough has changed, then the circumstances around that person, that athlete, means that then their system then settles down. Okay, things might calm down, there might be less inflammation locally, and there might be less neurological sensitivity, which is one of the things that can affect people's pain. And so essentially there's enough that's changed. And then when they start feeling more comfortable running, then there's all sorts of reasons as to why that might have resolved their issues. What it doesn't necessarily tell us about is that the specific things that were done with, from, to, and about them, it's not that any one or any combination of those things were specifically correcting for some of the faults that they once perceived to be the issue. And so that's where it's just tricky. And I'll come to what this means for you in a minute, but it's why it's tricky when I work with people that do not necessarily understand what is underneath what is causing the response and the results that they might get. If they perceive that to be something that was done to them, or that there is something really highly specific about that intervention, it means that they then feel quite in need of pursuing that healthcare service again and again, or continuing to stay in touch with, not rather than thinking this is someone that's helped me as a coach, and it's something that makes me feel better, and it's some person that I can consult with ideas and discuss things through. Is that people then start to then think that they need fixing at some sort of regularity, or that if I continue to run and I rest, what if I fall back into habits of running badly again? And they start to obsess over these things. And so that's why it's important to understand how things, how treatments or work and don't work for those sorts of reasons. This same sort of thing applies when people want to suggest that, it hurts because that muscle is weak or that joint is weak. and therefore just get it stronger, and then it'll all be okay. And so you've got all these different things where as soon as someone's trying to be oversimplistic, oftentimes they're trying to imply that that hurts because insert one thing, whereas we understand that human pain is far more complicated than that, and can be a whole host of different factors that can be turning up and down the volume of your pain at any given time. And of course, we're not suggesting for a second that certain times there are certain injuries that can be caused by a ruptured ligament or a broken bone, and that's absolutely, of course, happens. But even in those circumstances, there are lots of factors affecting what someone wants to do with their body that might mean that that is more or less of a problem for them at any given time. So hopefully I've not got too in the weeds and got too nerdy about this, but it was really interesting for me. The first thing that people wanted to suggest that I should try and explain and teach people is how some of these treatments work. And so whilst I know that will beg many a question, if we're not going to cover everything, I'm not going to go into how taping works or how core stability works or doesn't work or whatever. We can't go into every single individual thing, but just to give you a few ideas really around particularly the laying of hands, the manual techniques and massage, manipulation, mobilization techniques, as well as some of the ways in which we might change someone's biomechanics. It is not necessarily as specific as you might think, and that those that are implying that it's really specific are usually doing so as a means of implying, because that's where they feel their skill is. They've developed these particular techniques and skills, and so they want to they believe it, by the way. So I'm not suggesting for a second that they're lying, but they believe that that's where their skills that they've developed are the thing that you need to get this better. And also, to be fair to them, they get a positive feedback loop where they apply their techniques and someone gets better. They want to then understand that they then help someone. And they did help someone, but it didn't necessarily mean it was the specific thing that they did for the reasons that they think. And that's something that we've just learned from doing good scientific studies over the years. And so it doesn't mean they're not getting good results. It just means the reason underneath their results is different. And the reason that matters is because if they repeat it, there's in the wrong person at the wrong time, then it's not going to work. And so that's why they should adjust and recognize that it might be something a little bit more complicated than they're letting on. Now, one of the things that's worth me making sure I hammer home, just a second, is that what it means for you is that you need to make sure that when you're shopping around, that you consider carefully as to who is a credible person for you to consult about your health, pain, injury, fitness generally. And I think that's the thing, is that you might have heard the old phrase that if everything looks like if all you have is a hammer, everything looks like a nail. So if someone has their favored technique or they have their style of treatment and that they will use that hammer and that is all they wield, then essentially, no wonder when describing a problem, it looks like a nail. And so everything that might present to them may well be then put through and seen through that lens. And so sometimes that's because that's the nature of their skill set. So what you want to try and make sure you do is that even though it might well be that clinician, that practitioner, that person, that treatment might well be indicated for you, that you don't necessarily find that out by just having to try it, not being assessed thoroughly. So find someone that is going to be able to then be a bit more agnostic, be a bit more less wedded to a particular style or technique, and instead start to be able to see you in the round, right? Understanding your health, your pain, your injury, based on your specific needs. What do you do with your body? What is it you're doing for work? What is it you're doing life-wise? What's your background? What's your history? What have you done sport and exercise-wise? How old are your grandkids? How big's your dog pulling you on your dog lead? All those different factors that might be influencing the way in which you might live your life. And those things should be being considered appropriately when thinking about, right, what therefore are we dealing with in terms of a diagnosis and a problem? How is it affecting you? And then what might be needed in terms of care and treatment ongoing, and how might you be able to make adjustments that might mean that you can not just get on top of this as an episode, but then stay on top of that and live a healthier life ongoing. If you understand things better, you will be able to make better healthcare decisions. And that is one of the reasons why it seemed smart for me to start trying to share some of the insights that have come from what we teach other therapists and what we teach other doctors and surgeons and things as to the latest and greatest with regards to the scientific evidence. But the translation to that for you means be smart about who you then seek advice from to make sure you don't end up getting pigeonholed down into a treatment that is being implied to work for reasons that it doesn't, that are unproven. And that's why I couldn't help but exhaust my correlation and causation explanations, as well as then explain just a couple of examples of how pain and injury treatments work, and then, of course, how they don't work. Essentially, a lot of these treatments work through more non-specific effects than you might think. You have managed to change enough around your circumstances, what we call your homeostasis or your sensitivity, and then that chance to settle that down has meant that things improve. And that is the most important thing. So it will always vary from person to person. But as a general rule, if someone's implying that things are more specific than they are, then usually that's something that you should smell a rat. Really, is what I'm saying. That's the most suspicious thing, is that it's just one size fits all, and that's always a bit of a shame. So do make sure you're smart and scrupulous as to how you check and to pick the right person to consult on that. So anyway, that's enough from me. I'm really sorry about the throat, and I possibly should have left it again today because I wasn't well the last couple of days. But I know that second show, I had to try and get into a bit of a rhythm with these sorts of things, and so I've thrown one out there. So forgive me with the croaky voice, but I will click a couple of buttons, and hopefully my exit sequence, although still in the wrong branding and stuff, will fire up. But I'll see you next week.